somatopause is equally as important as testosterone in men and estrogen and progesterone in women, because a lot of our health problems are geared on the fact that you have, decrease in growth hormone over this period of time.
Right. So let me start by welcoming you yet again, Dr. Frankel. Thank you for taking time out from your extremely busy days to help us understand the new age treatments that are just revealing themselves to us and all the benefits of some of these very important peptides that are now even FDA approved for utilization. So, thank you for making us understand this. We already have recorded 3 episodes. We went through menopause, and we went through testosterone, understanding testosterone. We went through all your favorite peptides. And now today we are creating this episode to understand a very unique kind of pause, which is called somatopause. And I am so excited that you're going to teach me something extremely important during the coming 40, 50 minutes of this talk. However, I am very sure that this is not going to be enough. And at the end of it, we're going to plan our next meeting because whenever you come and answer questions, there are 10 questions we get that we also need you to come back and answer. So, welcome, Dr. Frankel, yet again. And how are you doing?
I'm very good. Thank you again, Dr. Din. It's a pleasure being here, of course. Excited to have these discussions with you and get this information out, because I think that it's important information for our patients. I think it's important information for the public at large. And I think that, it's a really kind of valuable information that people just will not get anywhere else. So I think that, the Bathroom Diaries is a trailblazer in this information. So I'm happy to be here.
Thank you. Bathroom Diaries is basically I created this podcast so that we can demystify some of these anti aging treatments and devices. And these peptides have become a front and center in all anti aging and longevity protocols. And people are looking for legit information, which is coming from board certified doctors who have trained in the dark side of medicine. And they are now also helping people how to keep their bodies healthy. So I feel that peptides are for health. It's less of disease management, chronic disease management, but it's more of continued health and wellness kind of treatments. So tell me about somatopause. Like, how do we get to it, and how is it different from a menopause or andropause, or is it just an offshoot of andropause and menopause, where we have to also treat these symptoms for people, who to
So,
treat and who not to?
right. Okay. Absolutely. So I just want to correct one thing, Doctor. I love you, and I,
I
I,
get it.
I rarely, disagree with you. But I think that instead of this being the dark side of medicine, I think we are the light. So yes, so it is. Somatopause is a completely different discipline that we're going to be talking about, and not a lot of people talk about it because, for many years, growth hormone has only been FDA approved for, the people who are, like the children who are deficient, truly deficient in growth hormone. It's very hard to test for. It's very hard to kind of tell, patients that they are growth hormone deficient. Unlike testosterone, estrogen, progesterone, it's very difficult to actually test for it. So because growth hormone itself only is in your body for a very short period of time, it gets into your body. Its half-life is seconds to minutes. So you really can't test for like the values of truly growth hormone. Plus, the one thing that we can test for is something called insulin growth factor 1, which is kind of the kind of workhorse of growth hormone. So you can test for it, and I do test for my patients to see where the levels are at and where the levels are to be. When people are in their 20s, their IGF-1 is somewhere in around 500. What we find is that from the age of 30 on, the IGF-1, which we can test for, which is kind of like the stand-in for growth hormone, because like I said, we can't really test for it, decreases by 50% starting at 30 every 7 years. So you can do the math and kind of realize that, by the time patients are in their 40s, 50s, 60s, their IGF-1 is somewhere around 150 or below. And at that level is truly deficient for these patients. So there is a way to test for what we're talking about today, growth hormone deficiency, and the best way to test for it is IGF-1. Now, what does that mean? So what is the importance of somatopause? So there clearly has been shown that, and I'm going to talk about a couple of major studies that were done, and they were done on patients that they weren't really kind of looking at this problem, but it actually kind of elucidated a lot of what happens to most of our patients with somatopause. What was found, and I'll just talk about the findings first, and then I'm going to go into the studies after. That the muscle mass was diminished by almost 30 to 40% of patients are insulin growth factor deficient. They increased their fat mass by almost 50%. The skin had thinned by almost 28%. The bone density had diminished to the point of osteoporosis on most of these patients. They had poor sleep, poor memory, increased fatigue, and increased stamina. So what does that sound like to you? I mean, to me, it sounds like a normal 50-year-old that is walking around compared to what they were in 30. So this is really kind of the kind of major kind of point saying that, somatopause is equally as important as testosterone in men and estrogen and progesterone in women, because a lot of our health problems are geared on the fact that you have decrease in growth hormone over this period of time. So that's the first point. Then I'm going to talk a little bit about how growth hormone is produced in the body. And so when we talk about growth hormone, I'm not talking about like prescribing growth hormone, but I'm talking about the growth hormone analogs. What growth hormone analogs are it gives you the chance of the body to actually produce its own growth hormone. So you have peptides that stimulate the production of growth hormone from the anterior pituitary, and then it produces the growth hormone, which produces the insulin growth factor, which has all these positive effects in the body. So it's a much safer way to use growth hormone analogs because it gives the body a chance to actually negative feedback on the growth hormone itself, because it produces its own growth hormone. And if it feels like there's too much growth hormone for whatever reason, it's going to stop producing it. Even though you're giving the peptide analogs, your body is actually involved in the case. And I think that this is a safer way to actually increase the production of growth hormone in a way that you're actually you're not giving the patients growth hormone per se, but you're giving their bodies the chance to produce more growth hormone. And things that we've talked about in other podcasts, Tesamorelin is one of the one that was FDA approved, and I'm going to talk about that study. CJC-ipamorelin is another growth hormone analog, which is also in FDA trials as well. And as well as another one that's popular is Sermorelin. So these are kind of like the three main peptides. And what they do is they increase the production of growth hormone. They're not actually growth hormone, but it gives your body the chance to kind of get the benefits of having more growth hormone without kind of just giving it growth hormone. So that's the first step.
Um, I just let me just I needed a little clarification in this thing
Sure.
that so would you tell us like why is it that um, we cannot give growth hormones in certain places itself, and we have to take like these analogs and give it? Why is that? Is it because of testing?
Well, I think part of it is that yes, it's hard to test for, and years ago, growth hormone itself was had a black box warning on it, and many states kind of took up this because of questionable risk of cancer. Now, I'm going to talk about that fact because truly, yes, growth hormone does produce more cells. So, of course, if you are abusing growth hormone, you can increase the risk of producing more cells that might be, cells that are latent cancer cells that can produce more. So the FDA put a clear black box warning on, the use of growth hormone per se without, ever looking at, what are the possible benefits of it. But they did do that in a way that they really didn't realize. So the only patients that can get growth hormone, they have to go through this test called the glucose tolerance test, where they literally make you severely hypoglycemic, and they see if your body can rebound from this. And you have to do it under significant monitoring, because the patients are going to become hypoglycemic. Initially they give them high doses of insulin to get them levels low, and they see that if the body can bounce back from that. And so because of that, there are no labs that do that in most states that they're going to check for, this glucose tolerance test to show is there true growth hormone deficiency or not. So, like kids that have small stature, that are concerned for, growth hormone deficiency genetically, those kids, they can use the growth hormone for these patients. But other than that, it's really, not, and it's not legal in New Jersey, which is where I practice, and I don't think that it's legal in New York. Now, there are certain states that it is legal to prescribe growth hormone.
Like which ones?
California is one of the
Oh,
big states
California
that,
is legal.
yeah,
So
California,
I have a California license.
yeah,
However, I actually sent you this kid who is an adolescent who's probably
um,
the age of your son,
uh-huh,
and he's an athlete, and he was
yes,
like his other fellow athletes were, some of them are cycling through uh, growth hormone
right,
analogs or something.
right.
And I wanted to ask your opinion on that also, because that is like that recurring question. Because I know when men actually need it, which may be much later in life, but what
Mhm.
do you say to these kids who are, who are like pros and want to become professional athletes? What do you say to those kids? And is this something that you would give to somebody?
Well, I mean, in those cases, I would, use the discretion as far as, each patient individually. You can test for their insulin growth factor, which can give you a good tool to say, are these patients, even if they are younger, are they deficient in growth hormone? And then again, I would, defer to going to the safer route of using the analogs, because we have them. We have the ability to produce more growth hormone, and you could actually test for it. You can see patients. I'll always get the baseline of patients and find out what their IGF-1 is, and then I could test for them 6 months later if they cycled through a growth hormone analog like Tesamorelin, CJC, or Sermorelin, and see what their insulin growth factor is. And almost, universally, these patients will increase their levels of IGF-1, and so you can actually test for it. So again, it depends on the person, it depends on their lab tests. I mean, we do everything like the right way for our patients. I don't give patients, anything that I think that they're just trying to abuse or trying to overdo. But I think that in some cases, sure, if they are deficient in it and they can benefit from it, then I think that there's no harm in it as long as you're doing it the right way. You're testing, you're constantly checking what their IGF-1 is, and you'll see, are you doing the right thing for these patients? So yeah, I mean, I think that it's fine. I mean, as far as whether prescribing growth hormone to these people is right or not, I think that there's a safer, smarter way to do it now. Now that we have all the growth hormone analogs, that we don't have to worry about getting into, the pharmaceutical or legal mumbo jumbo. We can do it in a way that's safe. We could do the way that the body is actually designed to kind of create stop signs for your body to not overproduce it. So I think that there's no reason not to just use the growth hormone analogs as your tool to be able to actually get the benefits of increasing growth hormone.
Oh, I see. I
Yeah.
see. No, it makes sense. However, uh, when you tell them to cycle, is there a specific way that they can cycle a growth hormone
Yeah.
for, like,
So
let's say for children, and how would you cycle for somebody who's like, let's say 60?
yeah, I mean, I think I would probably, kind of use similar cycles for these patients, and a lot of these patients I'll cycle them on 2 to 3 months on, 2 months off. And the reason why you do that is not the fact that you're concerned that they're overdoing the growth hormones. The reason why you're doing it is because we're going to talk about receptor sensitivity. And so, what you don't want to do is you don't want to overdo any type of production of certain hormones to make the body insensitive to it. So that's the reason why you cycle, because of the fact that you want the body to take the growth hormone in, get the maximum effect of it, and have the body like receive it, as opposed to if you don't cycle and you keep the patient on it for long term, the effects of it will start to wane because the receptors will start to become less efficient on it. So that's the reason why we do the cycling.
So
But yeah,
basically, these are analogs that will go and take the place of growth hormone, whatever receptors are supposed to be targeted for growth hormones, these analogs go and impact that same receptor?
no, it's not.
No.
That's not what happens. So what happens is that these peptides, which are a lot of them are natural, will affect the anterior pituitary. So our bodies cycle growth hormone at night, even into our 90s, all the time. But the thing is that they help to spike the cycle of growth hormone when our bodies are producing growth hormone. So it's important that you get good sleep, because sleep is the key to growth hormone, producing growth hormone. So when you're in deep sleep, your body pulses growth hormone.
Wow.
Everybody does this. Now, the point of the peptides is what they do is they help the pulse of the growth hormone to increase. So when you're sleeping, it actually increases your natural production of growth hormone, and that is what
Yes.
you're trying to do. So it's important that what I tell patients is there's two things that you need to do when you're taking growth hormone analogs. You want to put your body in the best possible situation so you're producing more growth hormone. And so what you need to do is you need to make sure you get sleep, but also there is one enzyme that actually decreases the production of growth hormone, and it's called somatostatin. So somatostatin is stimulated by production of too much sugar in your body. It increases the production of somatostatin. And so what I tell patients is it's important that you should try to fast before you go to sleep, decrease your sugar intake, because that is going to produce somatostatin, which is going to have the exact opposite effect of what you're trying to do. And so that is why it's important that we're on low sugar diets. because all the sugar that we're taking into our bodies are producing more somatostatin and impacting the amount of growth hormone that we're producing. So it's important to do high protein,
I
low fat. Yes, go ahead,
I
Sophia.
need one question here also. So,
Sure.
because I don't want to forget it. So, as you were mentioning somatostatin
Mhm.
and how high sugars or sugar spikes of sorts can decrease the production of growth hormone while you're
Yeah.
sleeping.
Yeah.
So, does the GLP-1 or 2 intake help with this process? Like, do you combine it with GLPs, or or would you just microdose somebody with GLP
Hundred
for?
percent, hundred
Oh, I
percent.
see.
Yeah, I mean it. So the point of it, what we're trying to do is the more we're going to, the more positive metabolic effect we're getting into our bodies. It's not only going to affect us more positively, less heart disease, less cancer, less hypertension. But the point of it is that it's going to help our hormones release and be the most efficient at these levels. So yes, so I'm going to talk about like in one study about fatty liver. And so fatty liver is kind of like this kind of nebulous thing. What does it mean? A lot of people have it, and why do we care about it? Well, I'm going to talk about like how fatty liver is affected. Like you taking the GLPs decreases your production of fatty liver. Now, why is that? So we'll go into this. I'm going to talk about this. This is going to get a little deep, but I think it's worth going into.
No,
So
I
fatty,
also stopped you from the somatostatin. I think actually, if you go back to that first diagram,
yeah,
Rocio, was I I think this one, yes.
yeah.
Um, so when you say somatopause, does it have something to do with somatostatin?
I mean, I think that to some degree, I think somato, hormones, one of being somatostatin, are, like growth hormone, somatostatin, all the kind of like the cycles of these anterior pituitary hormones. And so I think that that's the reason why they call it somatopause. But I mean, so for patients that that they have like tumors that produce too much growth hormone, they give patients somatostatin as the treatment to kind of decrease the production of growth hormone. So there is a direct correlation to somatostatin, and then you look at what like stimulates the production of somatostatin, and what it does is very high sugar, very high fat. These types of things in the body actually increase the production of somatostatin. So the whole point is that we go through this constant cycle where we're like becoming poor metabolic engines, because of the fact that we're gaining weight, we're producing too much sugar, and our bodies start to kind of run down, and that's what kind of leads to kind of all the problems that we have right now. And so one of the major links is that produces more somatostatin, which decreases growth hormone, which causes a lot of the problems. So there was a
Right.
study done in 2019 where for patients who had traumatic brain injury. And so this was an interesting study. So like, why am I talking about traumatic brain injury? Well, the reason is because patients who have traumatic brain injury, often damage their anterior pituitary. And so what they found is these patients were severely deficient in producing growth hormone. And what did they find about these patients? So what they found is that, these patients that, over a 6 month period that had severe like lack of production of growth hormone increased their waist circumference by almost 2 to 3 belt sizes. They increased their lean muscle mass by almost 40%. Most of them had an increased risk of osteoporosis. They also, had increased risk of Alzheimer's, dementia, memory problems. They found that, like, they actually did studies where they found that with these patients, they actually had a decreased production of glucose that got into their adrenal cord, their not the adrenal, the the cerebral cortex. And so what that means is that if you don't, our brains need sugar. And so if we can't get the sugar into our certain parts of our brain, that it's going to affect, the functioning of our neurons. And so what they found, these people had decreased memory, decreased executive function, all because of the fact that they decreased the production of growth hormone. They gave these patients growth hormone back, and they found that they had improve their waist circumference, improve their overall fat, increase their lean muscle, and it also increase their memory and executive function. And so that was one study that was done. There was another study done in 2021 where they actually looked at these patients who also had a brain injury, also decreased production of growth hormone. They all had decreased exercise capacity, increased fractures, secondary to osteoporosis, decreased fat mass, decreased muscle mass. And there was a third study where they actually gave patients growth hormone for these types of injuries, and they improved, by markers of almost 30 to 40% on all these factors once they did. So we're looking at our metabolic system and saying like, hey, we're losing this hormone. However, no one talks about it, no one thinks about it, but all these people who are truly deficient are having the same metabolic problems that so much of the population is having without, actually kind of looking at it directly. So that's the reason why I say that it is incredibly important to think about it. This was one great study, and the study was done, specifically for patients who, had traumatic brain injury. But they found that all these people were deficient in growth hormone, and they had all these negative effects. And yet, if you look at our full population, a lot of our patients have these same things, but no one is kind of linking that towards the same problem.
Yeah, no, I get it because we hardly even talk about it. And this is the first time that we're doctors are actually taking this seriously. And even earlier when I said that doctors, I feel that doctors who have trained in the dark side of human disease, where
Right.
chronic
Yes.
disease management, they
Right.
become the best workers of light because you have seen what just letting yourself go into the aging and helplessly aging can lead to. So it is much better to find people like you who have trained in that disease management system to preserve health. So something like the growth hormone, like I want to go and check mine. So if I want to go and check my stuff, what is the blood test that I should order for myself? Are routine labs able to perform these tests?
Yeah. So, I mean, like I said, the best test that you can get is the IGF-1 blood test, and yeah, I think that most insurances will cover it. I mean, it's a level of kind of when they're testing for kind of um, any type of metabolic crisis or any type of like patients who are overweight, things like that, they will test for IGF-1. So I routinely test my patients for IGF-1. Like I said, for somebody in their 20s, 30s, their IGF-1 is around 500. But as we get to, more adulthood, if you're at the level of 150 or below, that's truly deficient. But I would say, just like testosterone, those levels should probably be higher, for most patients because they should be closer to probably 400, 400 to get to the same levels. So I think that yes, it's definitely incredibly important, to test for that. And I use it routinely now in all my lab patients for all
So
my
how
lab.
often would you test it, for instance, if
So
you're on growth hormone or if you're not on growth hormone?
I mean, if you could test for it, I mean, you could get a baseline, but if I put patients on the growth hormone analogs, I will test for it every 6 months, just to see where the levels are going, to make sure that, the levels aren't going too high, or we're making progress. So I think that that's really important.
My next very, very important question for some of us will be, how much does something like this cost
Sure.
on for somebody who is in andropause or menopause, or somebody who's just a young kid trying to cycle through a couple of courses?
So, I mean, as far as, going through a cycle, it's, usually, like I said, there's like 2 month cycles. It's about $300 a month. So, for like a full cycle of 2 months, it's probably like $600. Somewhere in that range for most. Some of the um, analogs are a little less expensive. I mean, I'd say somewhere between 220 to 400, depending upon what you're using. But again, what is it worth for your health, Dr. Din, right?
Yeah, no, of course. I mean, it is not something that
No,
is
it's not
so
overly expensive.
cost
Yeah.
prohibitive
Right.
that if we tell somebody, somebody's going to be like, "Oh my God, no." Um, it's doable.
Right.
Seems doable to me. And then one other question would be, who would not be a candidate for something like this?
Well, again, you want to be careful with patients who have, like obviously active types of cancers, because of course, growth hormone can overall produce, increase cell production. So that's the one thing you want to, obviously, anybody has tumors, things like that, has an extremely high risk of cancers. You might want to be very cautious with those patients as well. But I'm gonna tell you a little, fact. Like in 2013, there was a study that was done in Harvard, and these were on HIV patients. And so what they found is that these patients, all had what's called lipodystrophy, which means like fatty liver, kind of like fat in their visceral section. And so they did this study with Tesamorelin. I did talk about this study a little bit with you, but I didn't talk about like what the point of like why it's so important. So a lot of our patients have fatty liver, right? So fatty liver is usually secondary to the fact that the bodies are insulin insensitive. So meaning like we're eating too much sugar, we're producing too much insulin, and then when too much insulin is sitting in our bloodstream, what happens is that the bodies produce more fat, because it's kind of like stimulating like insulin. It actually stores fat, and so what happens is eventually our bodies kind of like say, hey, there's not enough room for this fat here. I'm going to put it near our organs. And specifically, you see a lot of patients with fatty liver who are metabolically challenged. And so the important thing to understand about that is that, with fatty liver, so that when they did the study with the Tesamorelin, the patients decreased their production of fatty liver by almost 40% over like a 6 month period. So that they lost a large amount of the fat out of the visceral fat, as well as kind of midsection fat, belly fat, which we all worry about. 30% of those patients decreased their visceral fat and their belly fat by almost 30 to 35% within 6 months, which most of our patients kind of like, okay, great. I mean, this is great. I'm losing my belly fat. But more importantly, fatty liver actually increases their risk of heart disease by almost 60%. It increases their risk of liver cancer by 91%, increases their risk of high blood pressure by 50%, and it increases their risk of producing more triglycerides and LDLs by 70%. So the study was done showing that these patients lost, their visceral fat by a large percent. And the reality is that a large percent of our patients have like fatty liver disease, and no one really even kind of addresses it. And the point of it is that many of these people have it because they're type 2 diabetics. And I talk about this a lot because even on our first episode, I told you about the one peptide I worry most about is insulin. And the reason is that people who are insulin insensitive are type 2 diabetics, right? So our bodies cannot no longer receive the insulin the same way. The receptors are no longer recognizing insulin. So what you have to do, so more and more insulin is being produced to try to get, the sugar into the periphery. So a lot of times, what the medical community will do is they'll say, well, let's give these patients insulin because their sugar's still high, their A1Cs are high, right? The better choice, of course, is things like GLPs, a much better choice to help them stabilize their insulin. I talk about this like because of the fact that it's like think about like the idea like if you had a lock that if you had a lock that that was only working on a key that was um, 1 out of 100 times you put the key in and only
Yes.
like fixed 1 out of 100 times, would you buy more keys or would you fix the lock? And that is what we're talking about, like meaning like the receptors are no longer recognize the insulin, so you don't give the patient more insulin to fix the problem. You fix the receptors. And that by doing that, by giving them more receptors being produced, like by giving them GLPs or kind of like producing more insulin insensitivity, by giving them products like um, Tesamorelin, BPC, things like that that are going to help the receptors work better. That's the way to fix the problem. So this is another thing that drives me crazy about modern medicine. Why would you buy more keys? Just fix the lock. So
Yes. I think this is like where you should drop the mic and it's you made that point.
if I had the mic,
Yes, there is like, this that's where you drop the mic
right,
after this because it totally makes sense.
right,
How to make your liver lose that fat. One of the ways I explain it to my patients is that fat is like in the realm of your body, fat cells are like plastic
right,
and they basically clog your system. And not only they are like plastic in your system, they're constantly producing these microparticles and releasing
right,
them into the sewage of your bloodstream,
right,
which will go and create inflammation and block
right.
those arteries and create strokes and heart attacks and other kinds of problems.
Right.
And the insulin resistance is such an important part of any pause. So when we are doing GLPs we're giving GLPs to people, that what I also am noticing in my own people is that not only they drop the weight, which is like, the fat cells, a kind of anti-age. It doesn't eliminate the fat cells, but it definitely shrinks their size, and it also helps the body to produce less of those inflammatory particles that fat cells are constantly producing in the form of bad cholesterol and stuff. So I feel that that also is a very good part of growth hormone. But now, as you're saying that when they get the growth hormone, it actually completely reverses many of these problems, which I think is probably at the level of the receptor. It's not like the key is the medication that we're trying to insert. So
Right.
we gotta, change the way the body is producing. So you're just going to the other side and saying that let the body fix itself. And human body is such a miracle making structure because when you give it the right instruction, it will create the miracle for you that you're seeking. So I 100% agree with what you're saying, and I'm just relieved that somebody came out with this, and it's been
That's
going on long enough.
right.
Um, what else? So there is Tesamorelin, there is CJC-ipamorelin. Is there anything else that is in the market, and where can people find you?
Yeah, Sermorelin is the other peptide, and they all work differently. So don't get, like, I tell patients don't get, like hyped up on, one peptide analog versus the other because they hear something online. Everybody's different on what works best for them and what will work best for them. Yeah, you could certainly go to the Dr. Frankel at Modern Man. You can go to vitaliwellnessclub.com, find us there. But I mean, the point is that like these things are so important, but you really need to do it right. Stop the hype. I want you, like everybody should be talking to people like yourself or myself, to really understand like how you're going to improve your overall health, your overall kind of metabolic health, but also, it has a lot to do with your, cognition, your memory, as well as muscle mass strength, all this. I mean, most people think of it as a thing that you get when you go to the gym, like, oh, I'm taking growth hormone, I'm trying to get bigger. And that's true too. I mean, you do gain muscle, gain lean muscle, but I'm looking at the true health effects of what these things do. And it's incredible when you actually look deeper into it and see like, hey, like this is already documented. The point is like no one is actually like taking one step further and saying, well, if this is the case and these people, we're getting growth hormone and they decrease their fatty liver by almost 40%, they are all getting healthier because fatty liver causes all these problems. You only have to go one step further to be able to make the connection and say, this is actually a really important thing for a patient's health. Another blood test, I would say, Dr. Din, that you asked about blood tests, that I use and I think is important is something called fasting insulin test that you could do with all your patients as well. Fasting insulin tells you how much insulin you have in your system without eating. And you just tell them fast from the night before. And if the levels are in the 20s, then you know that these patients are heading, even if their A1Cs are normal, they're heading to insulin insensitivity and possible type 2 diabetes. So this is another thing that you can kind of show them as well, to really say like, what these are. And in that study that was done, that I just talked about, the Tesamorelin studies, they decreased their fasting insulin levels by almost 14 points. When they looked at these patients, as well as their triglycerides lower, the cholesterol, the LDL is lower. But the one thing that really stuck out to me was that their fasting insulin levels dropped by 14 points, which means that when you're not eating, your insulin levels are normal. But if you are eating and the levels are high, it means like your body is constantly trying to kind of get the insulin to work so it produces more, which is not a
Oh, I
good.
see.
Yeah.
I see. I see. How often do you give growth hormone? Is it like a once a week thing? Is it once a month thing?
So most of the growth hormone analogs are daily, 5 days on, 2 days off, meaning like you take the weekend off. Again, and it all has to do with receptor sensitivity is the reason why we do it this way, because we want the receptors to be most efficient. We don't want them to be oversaturated. So some people take CJC with something called DAC, which helps it bind to like receptors, so you could take it less often. Again, it's kind of like I'm kind of mixed on whether this is a good idea or not. I kind of feel like it's one of those things similar to giving pellets and giving like giving the transdermal patches as opposed to like using the creams daily, because I feel like it kind of doesn't give us a good idea of how much growth hormone is being produced daily. And what I'll say is that it's important that when you do the growth hormone, again, I'm going to emphasize this again, it's important that you sleep. It's important that you get good sleep. It's important that you try not to eat, especially probably an hour to two before you go to sleep, which is a good health topic to begin with. But the reason is because if you eat like right when you go to sleep, you're producing too much somatostatin. And what are you doing? You're suppressing your growth hormone. So obviously, you fast before you go to sleep, you take the growth hormone analogs at night, and then it will pulse while you're sleeping. So,
Oh, wow. Yeah, no, so that's so you people and is it something that you inject or is it something are there any oral things or transdermal things?
um, yeah, I think most of the growth hormone analogs, I don't know of any preparations that aren't injectable, sub-Q. Injectable. I mean, there might be out there, but I honestly don't know of any that are. And I would be a little bit, concern that, they wouldn't get the metabolic effect appropriately orally. So, I mean, this is like growth hormone, the amount that's it's being produced, how it's being produced, it's very finicky. So you really need to, make sure that you do it the right way. Like I said, like do it at night, do not eat before you go to sleep, make sure you get good sleep. All these things are, and just in general, just sleeping alone, you could produce your own growth hormone without doing anything. So if you can produce your own growth hormone by eating, better, decreasing your sugar intake, decreasing, like the the bad fats that you're eating, because all these things are producing more somatostatin, which is inhibiting your growth hormone. So naturally, you can, just do the right things, exercise. All these things are going to decrease somatostatin, which is going to ultimately give you a better pulse of growth hormone, like naturally, without doing anything.
Wow. Are there any foods that can give your natural growth hormone a boost, or any other supplements?
Um, there are a couple of, again, that if you look at the pathways of how they get to the pituitary, can produce more of things that you don't want. So again, I feel like the best way as practitioners now, the lay public is going to hear lots of, things, but as practitioners, I want to do, I want I want to give the patients exactly what they're asking for and exactly what they need. And so I think that, taking the time to just give them, the analogs, but definitely, like I just said, like to give yourself the best kind of effects to produce your own growth hormone. I mean, you could do a fast. You could do a 24-hour fast. That actually does increase your growth hormone pulse by doing just drinking, drinking water, just drinking one day and completely fasting. That completely, lowers your levels of somatostatin down to a level of, that is low. But it also allows your body kind of think about like producing more growth hormone. So fasting itself is a great way to produce your own growth hormone. Um, and obviously
Wow.
cutting down anything that's producing insulin, because insulin is one of the major impetuses to produce somatostatin, which is gonna be the link to suppressing growth hormone. So anything that you could do in that way, I mean, there's a kind of a natural kind of balance between the two, just like estrogen and testosterone for men. Somatostatin, which there's a lot of most of the things that produce somatostatin are usually bad. So think of the bad things that you do, prevent those, and those will help you produce more growth hormone. So that's really kind of the thing without having to inject anything. So that's one way you could start on your own,
Mm.
to get the positive health effects.
Well, that was great. I have a lot to digest with just this. And I think, sometimes some of us will have to just try it to see how to go about it. So
Yes.
do you do any checks before you start somebody on growth hormone
Yeah, I mean,
analogs?
I think that it's important, as practitioners that, we do a thorough history of our patients, kind of know, exactly what their history is, their family history, just to know that what you're doing always is something that's going to be beneficial to our patient and not harmful. I mean, I think that that's really important. And then, like I said, we'll check their metabolic levels, their fasting insulin levels, their insulin growth factor, and any other, things that are red flags on their blood work. We'll obviously search and look at. But I mean, I think ultimately, in the country again, like I think that there's an epidemic, of patients who, it shouldn't be this way. We shouldn't have, in our country, which, we're one of the wealthiest countries on earth, shouldn't have such high levels of cancer, heart disease, hypertension. And there is really kind of the fact that, our medical system is more geared towards, like, band-aiding symptoms as opposed symptoms or the effects of our metabolic crises as opposed to trying to fix them. And there's lots of reasons why I think that is, but I'm not going to go into that today. It's too
That's our next
controversial.
episode. I know that
Yeah,
we're on a timeline, so we're like we were exactly on a time. So
exactly.
thank you so much. We're like if there are any other closing remarks for this. Otherwise, my one question would be also you recommend all of this for women also.
Yes, absolutely. 100%. 100% women.
Because when we say growth hormone, we're like thinking of men
Right.
who are these
Buff. Right.
gym
Right.
rats who are like
And that's the reason why I
showing
didn't.
off their biceps to each
Exactly.
other. So it's like feels like a more of a bro thing.
Right.
And I feel that the one of the biggest paradigm shifts for me is that it's not just a bro thing; it's also a girl thing, and we
It's
need
a
to
it's
look
a
at it
human
also.
thing. It's a human
Huh?
thing. It's a human thing. It's a health thing. This is
Mm,
why I didn't even talk about, the effects on muscle, lean muscle. I mean, I mentioned it briefly, but like what I wanted to point out, in a very strong way is that like this is a health thing. Like
yes.
this is all, like I said, all our medical and metabolic problems stem from three things: hormone deficiency, energy deficiency, and insulin insensitivity. And so, when we can kind of crack the code of that, I think that we'll have a much healthier population, a much happier population. And I think that that's what we should be doing as medical professionals,
Yeah.
really trying to help our patients like be their best.
Yeah.
Somebody said something the other day. It's not like longevity is not increasing your years in life, but increasing your life and your years that you have. And so I think that is really kind
Yeah.
of what we should be doing. So
Yeah. Yes, longevity is not about how many years you exist. It's your health span, and your health span has to align with your lifespan.
right.
And I think that this not just will it also, yeah, of course, by extending your health span, you are already extending your lifespan with
Absolutely, of course, of
with this.
course.
So
I think they go hand in hand, but I mean,
yeah,
obviously, like we don't know, like we don't know what our lifespan is going to be, but during the time that we are here
yeah,
on Earth, that we
yes,
should be, our healthiest, and we should be thriving. That's really,
yes.
that's what, I had a patient come in yesterday, and he started a new job where he's working nights, and he said, you know what, he said, usually, like this really knocks me down working overnights and stuff, and he said, but I'm thriving right now, and that's exactly what we want to hear from our patients. So
So, is there a particular time you tell people to inject the growth hormone?
yeah. Yeah. Usually, like I said, 2 hours before you go to sleep, because the
Mm.
pulse is going to happen while you're sleeping. So,
Oh, I see.
and then you fast 2 hours, before you go to sleep. So that will decrease the production of somatostatin. Um, so that's the best
Nice.
time to do it at night. Your pulse is while you sleep. So it's important to get good sleep, because
Yeah.
that's going to naturally produce your growth hormone. But then when you
Mm.
add the analogs, it's going to give you a stronger and more sustained pulse. So,
Beautiful.
yeah,
Thank you so much, Dr. Frankel.
you're
I'm gonna
welcome.
see you in your next episode where
Yes,
we're
yes,
gonna bring all of these pauses together, because right
yeah.
now I'm just busy trying to wrap my head around the fact that how this pause turns men into women and women into men, and how we have to keep them keep them feeling like themselves, but an
And we
enhanced
have to do
version
we have
of
to do our hour
themselves.
1 hour on insulin itself. So
Yeah.
I,
Yes.
I, I don't
Uh,
I didn't forget that one, because I have probably 4 hours on that one, but I'll slim
wow.
it down to an hour. But yes,
Wow. Okay, so now next one is going to be on on your
insulin
on
sensitivity.
insulin. Yes,
Yeah.
because there is like so much misconception on that medication, and I still have patients who are on it.
Yeah,
And
well, I mean,
it's
like I said, the reality of what I just said about the key and the lock, like that's all.
yeah,
Again, you don't have to do studies to look at common sense, right? If
yeah,
you have something that is not working,
yeah,
why would you put, like you fix you fix what's not working as opposed to throwing more of it in, which is end up having these negative effects, and that's
yeah,
the reality of our medical system,
yeah.
unfortunately. So,
Well,
but
I
yes,
am
that's
so
great. Thank you
grateful
again.
I'm so grateful for you, Dr. Frankel. I'll see you in the next episode of Peptide Playbook series. It's like really informative. I have so many people who are reaching out. I hope we try to tag you in every
Yes.
segment that we post. I'm not posting too much on TikTok because of some guidelines that they
Mhm.
have, which I don't know. I think very soon they need to update their guidelines because, I mean, if doctors can't speak about this, then who will?
I agree.
So, letting people get to this information and making this information accessible is, both of our, it's a goal of mine, and I'm glad that we have similar goals to bring it to
Yes.
people. So
Yes,
thank you
absolutely.
again, and I will see you next week.
All right. Take care, Dan.
Thank you. Thank
All
you.
right.